Without question, the greatest toll of the past 24 months has been the devastating loss of life. For those still working on healing the body, mind, and spirit, the journey continues. Here now, our chief medical correspondent, Dr. Jennifer Ashton.
Even as we try to move on after 2 long years, some things remain. Almost 1 million dead in the U.S., over 6 million worldwide. And estimates of up to 30% of once infected Americans still suffering from a range of symptoms people call long COVID.
One day could be okay, and the next day I'm on the floor having convulsions.
What we're seeing is a very wide distribution of both age, sex, ethnicity, pre-existing condition versus healthy patients. So you're not protected if you're young and healthy.
One pandemic necessity that's become a silver lining: telemedicine.
And what a lot of people were saying, hey, this might be a great way to reach those populations who have geographical barriers, people who are in rural areas, people who may not have a car.
In fact, telehealth visits for Medicaid patients surging 500% in 2020.
What a lot of us are hoping is that telemedicine is here to stay.
But silver linings can be overwhelmed by other legacies of the pandemic.
The revolt at Spotify, protest the spreading of COVID misinformation by Joe Rogan.
What we have seen in the last couple of years is misinformation at a scale, a scope, a sophistication that we never experienced before.
We have to teach the public to take a second before you share a post, before you share an article, and make sure it's from a validated source.
COVID's true toll will likely be felt for decades. Surgeon General Dr. Vivek Murthy recently sounded a warning to Congress about the effect of the pandemic on children.
And the impact that's having on their mental health is devastating.
To best understand how to move forward and heal, we joined him at the Ida B. Wells Middle School in Washington, D.C.
It's nice to meet you. I'm Vivek.
Nice to meet you.
And this is Dr. Ashton.
Dr. Ashton, you can call me Jen.
I feel like that little kid in me disappeared, and I started worrying about stress.
Dr. Murthy has been doing listening tours like this with young people around the country.
Do you have any thoughts you want to share there?
It was kind of hard at first to open up about my feelings.
We didn't really talk about mental health a lot before COVID.
Don't just treat us like, oh, you're a child. Treat us like what we've been through is as equal to what you've been through.
Why is it so important to do this listening tour?
Our kids were struggling long before the pandemic arrived, and the pandemic's been more challenging for some children. But if we want to address this, we've got to listen to kids.
18-year-old Emma Brunn lives just outside Dayton, Ohio.
I wanted to be a bird when I grew up. And so gymnastics was the closest thing that I could get to flying.
Emma started gymnastics at age 9.
Good job, sweetie.
After COVID closed down the world, the loss of time with others and the sport she loved felt devastating.
Had kind of a little bit of a shaky mental health at that point. And so when COVID hit and all of these things just all of a sudden went out of my life, it really went downhill.
Even after gymnastics resumed, she continued to struggle with anxiety, self-doubt, and depression.
It definitely led me into a dark place. I just kind of felt disconnected. I felt like, where is this gonna go? What is this leading me to? And in February of that year, I ended up attempting suicide.
Emma had taken an overdose of pills. Her parents rushed her to the hospital.
There was just a lot of shock, beyond words.
But when it came time to find long-term help, her parents hit a roadblock.
Every single place we called did not have room for her. No available beds.
Brian and Sybil finally found Emma a bed, but they had stumbled onto one of the hidden problems of the pandemic.
I can't find a bed for my daughter. Why? Because hundreds of other fathers are dealing with this exact thing at this moment.
In fact, suicide attempts among teenage girls soared a shocking 50% in the first year of the pandemic. Help became harder to find.
We've heard of wait lists up to 6 months to a year for child psychiatrists.
What are some answers to address that?
We need to train psychologists and therapists, and we have to think about how we train families as well, including parents, in how to identify concerning symptoms. We need to support peer support programs, which are also an important part of supporting kids.
Show of hands, if you know someone that at some point has self-harmed.
Filling that gap here in Mason, Ohio, the Hope Squad.
Tons of people needed help during the pandemic.
It's our job to watch out for our peers and direct them to the help that they need.
Today, they are role-playing on how to handle self-harming behavior when they spot it.
I just get really angry.
I'm here to listen to you. Like, I'm here. Or we can both go to a counselor.
What we're finding is so many of our kids want to help. They hear more so than us through social media and texting and in ways that as teachers we don't see that.
One silver lining that has come is the amount of discussion and awareness that has happened to talk about their own mental health struggles.
When people know they're not alone, it really helps.
Let's go, Emma! Today, Emma is competing again and managing her depression. But for her and others, the pandemic has changed them.
Part of this era of my life is going to be stuck with me. It's going to make me a stronger person, which will prepare me for next year and the year after that. Even if COVID doesn't go away, I will still be a stronger person.
There's something that gives you hope about the future.
Something that gives me hope is my mom. She's my best friend, she's been there. And seeing her go through a stressful time during the pandemic, goes to work every single day at 4 a.m. just so I can go to sleep fine and eat every single day.
Wow.
I want to do the best I can for her.
Thank you for sharing that.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.